Hello, friends. Recently, one of the students asked me, what's the difference between a double marker test, a triple marker test, and a quadruple marker test? So, I thought I'll make a quick short video for you to clarify the points. First, the double marker test. This test is performed in the first trimester, typically between 9 to 13 weeks of pregnancy, and it is based on beta SCG and PAP-A, pregnancy associated plasma protein A, and the values are to be read with the nuchal translucency scan, NT scan. Based on that, you can get a positive result or a negative result with a risk ratio, which tells you the probability of a trisomy, most commonly the Down syndrome, but the other trisomies also. But it only tells you about the risk, not the exact diagnosis. Exact diagnosis obviously has to be confirmed with amniocentesis or the coronary sampling. On the other hand, the triple test or the quadruple test is done in the second trimester, typically in between 15 to 22 weeks. It also includes beta SCG, but it doesn't have the PAPA. It has the alpha fetoprotein and the estriol, commonly written as E3 and conjugated E3. So that would make the triple test. If you add inhibin A to this, that becomes the quadruple test. Again, the triple test or the quadruple test has to be read with the nuchal translucency scan. You get a positive or a negative risk profile and a risk ratio, which is given in terms of probability of the occurrence of a trisomy. Again, this is a risk profile, this is not a diagnosis. The confirmation of the existence of trisomy must be done using the amniocentesis or coronary villus sampling. At this stage, it would be the coronary villus sampling which might need to be done. Now, this is what we have been doing, and this is what is cost effective, but I'm sure you know that we also have what is known as the non-invasive prenatal testing, NPT or NIPT. This NPT or NIPT will take the maternal venous blood. From this, we extract the cell-free DNA. The cell-free DNA is segregated into the maternal cell-free DNA and the fetal cell-free DNA. This fetal cell-free DNA is then subjected to gene sequencing to find out the percentage of the chromosomes 13, 18 and 21 to get an idea of the trisomy. Please note that NPT is also a screening test, but it has a much higher sensitivity and specificity compared to the double screen, triple screen or the quadruple screen. Obviously, if you get a positive result in this test, confirmation has to be done via amniocentesis or the coronary sampling, but this one has much higher sensitivity and specificity than the double, triple or quadruple markers, meaning if you get a negative result, it is unlikely, very low probability, 1 in a million chance, that it is a false negative result and the pregnancy actually has a trisomy. This is not so for the other tests, but yes, it is true for NPT. NPT, unfortunately, is a little bit costlier because of the involved gene sequencing. The interesting thing, which is a recent development, is that now we have a validated rapid polymerase chain reaction test, droplet PCR, which can also test for the trisomies. So that is an interesting new development, which is very cost effective in comparison to the NPT or NIPT, having the similar sensitivity or maybe even better sensitivity than the gene sequencing, which helps us to identify the trisomy. Thank you very much.